Hi, everyone. My name is Olivia DeCurtis, and in this brief video, we'll look at Team 7 Singapore's health system and how it changed over the decades. The group did a great job showing the evolution from post-independence reforms to the launch of Medisave and Healthier SG in 2023. I like how the team incorporated engaging figures, showing the influence of primary care networks, financial subsidies, and Healthier SG participation rates. Focusing on preventative care, the presentation emphasizes the stress on population health instead of episodic or acute illness care. As your team had mentioned, care was achieved through community based health initiatives and primary care services. Overall, the presentation effectively demonstrated how the impact on Singapore's primary care structure influences partnerships and effective financing. The emphasis on preventative health shifts the costly focus from inpatient chronic disease management to strategic care delivery outside of the hospital setting. To strengthen your presentation, the team could have added specific outcome numbers, such as the reduction in hospital admissions or annual emergency department visits. This would show the impact on community nursing posts and how they were achieved status after the program was introduced. I would also like your group to have included more short patient journeys, for example, walking us through, for say, how a 45-year-old patient with hypertension and diabetes who enrolled in Healthier SG was able to select a primary care center. This would allow the patient to receive education on disease management, avoiding overall hospitalization, highlighting one of the key aspects of the health model. Your team did a nice job explaining the impact on population health, but could have broken it down even further, discussing public versus private roles. For example, analyzing the percentage of those who see polyclinic physicians versus private clinicians. Three questions that I have for the team. How does Singapore motivate hospitals financially when their success decreases their own inpatient revenue? How does the health system ensure that health promotion remains supportive rather than stigmatizing, especially for chronic disease management? Could Singapore's government maintain the support of public health programs if economic growth slows or demographics shifts further towards aging? These are just some things to consider. The Singapore/population health model builds a strong connection to concepts we've learned throughout this course. Johnson and Shee's discussion stresses a proactive approach and that systems designed around primary care foundations achieve better health outcomes. In the Alexandria Health System Harvard Business Review case, we learned that preventative interventions can also use resource utilization more effectively by decreasing costly hospital spending. For my comparative research, I used AI differences and similarities between Singapore and the US. The prompts that I entered were to compare the Singapore population health system to the United States in terms of financing, delivery, and outcomes. The analysis that I was able to take away from the AI generation was that Singapore invests heavily in proactive approach, focusing on primary care and prevention, where the US, on the other hand, focuses more on subspecialties or specialization. Singapore's health system demonstrates to us that better cost control and longer, healthier life expectancy, while the US struggles with fragmented care, high spending, and the impact of chronic disease burden. Fragmented financing through a multi-payer system is the biggest challenge that the US health system faces. This will prevent us from adopting a population health module easily. Multi-payer systems and a lack of unified incentives that do not prioritize prevention. A proposed solution can include the expansion of value-based reimbursement models, rewarding long-term sustainable health outcomes. This solution would align incentives and gradually shift the US towards a preventative population health model. Thank you all for listening, and I look forward to hearing your perspectives.